Hello everyone, I'm Arlene Brun from Thorax State University College of Nursing BSN 1D. So for today, we will assessing the thorax and the lungs. So procedural step, instruct the client, explain the assessment process to the patient and secure the verbal consent. And explain that you will be touching the client in a various areas using your hand and report if there's any pain or discomfort and provide the client privacy and well-lit room. So before anything else, perform a hand hygiene to remove all the microorganisms. So hello po sir, I'm your nurse for today, Arlene. May I know your name po? Okay po Sir Gab, so ilang taon na po kayo sir? Kailan po yung birthday niyo po? Okay po sir, and then after that is for the subjective data, we have the current health status, the SOB, DOB, cyanosis, the cough, sputum, the chest pain. So sir, meron po ba kayong kasalukuyang ubo or chest pain po sir? Okay po sir, thank you. And then after that, the past health status, the lung disease, the allergies, exposure, oxygen, medications, vaccinations, and smoking. Sir, nagkaroon po ba kayo ng lung disease before? The exposure po, the allergies, smoking po sir, medications po, the use of oxygen po, or vaccination po sir. Okay po sir, thank you. And then after that, inspection of the anterior thorax. Position the client, and the client should be in a sitting position with clothing removed except for the examination gown and the drape. And then after that is to instruct the client to breathe normally. Sir, can you breathe normally? Okay po sir, thank you. And then after that is to observe the skin color. Pink is the undertones indicate normal oxygenations, and then skin color should be consistent with that of the rest of the body, such as lip and the nail bed. So sir, patingin po ng nail bed nyo. Okay naman po. Yung lips po, tsaka po yung skin color nyo po is normal naman po. And then after that is to inspect the structure of the thorax, slope of the ribs, and the symmetry. So okay naman po siya sir. Pantay naman po yung ano niya, yung symmetrical naman po siya sir. And then after that is to the structure of the chest and chest movement should be symmetrical. Sir, can you breathe po? So, okay naman po yung movement ng chest nyo. And then after that is observe the muscle of the chest and the neck, including the normal intraction, substernal, intercostal, the suprasternal, and use of accessories. Tingnan lang po natin yung movement ng muscle niya, sir. Okay naman po. And then after that is to inspect the chest configuration and the shape. So first is the adult transverse diameter for the approximately twice that of the antero-posterior diameter. And then for the abnormal chest, barrel chest, and the carinatum. And after that is count the respiratory rate and observe the depth and the rhythm. And then after that is to count the number of the respiratory cycles per minute. 12 to 20 is the normal rate per minute. So normal naman po siya sir, 16. And then, after that is to do not tell the client that you are counting the respiration. It may alter the normal breathing pattern, and respiration should be even or smooth. And then, after that is male tend breathe abdominally and diaphragmatically, and then for the female, breathe is the costally or thoracically, and then the abnormal is tachypnea, bradypnea, apnea, hyper, the Kussmaul's, and the apneustic. So for the palpation of the anterior thorax of the patient, so palpate area of tenderness, lesions, masses, or crepitation on the sternum, ribs, and intercostal spaces. So, papalpate ko lang po, sir. If there's any masses po, okay naman po siya, sir. And then after that is to locate the suprasternal notch, and then palpate downward to the sternal angle, and then where the manubrium meets the body of the sternum, and then palpate the laterally to the left and right, and locate the second rib to the second intercostal space, and then continue palpating the sternum to sepoid process and to the left and right of the sternum to count the ribs. Okay po, sir. And then after that is the sternum should be filled flat except for the ridge of the sternal angle, and should be taper and sepoid, and the rib should be filled smooth, and then the spacing of the ribs and intercostal spaces should be symmetrical. Okay naman po siya, sir. Symmetrical naman po siya, sir. Wala po akong nakakapang any kinds of problem. And then after that is slightly palpate the anterior thorax. So use the finger pads, include the entire thorax by starting at the areas above each clavicle and move side to the below, and the costal angle laterally mid the axillary line. And then after that is to muscle mass should be firm, and underlying tissue is smooth, and then the chest should be free for the lesions and the masses, and then the area should be non-tender to palpation. So sir, papalpate lang po natin if there is any kinds of masses, nodules, or any kinds of pain. Sir, ngayong hinahawakan ko po or pinapalpate ko po itong parte na po ito, may nararamdaman po ba kayo any kinds of pain or discomfort? Okay po sir, good po yan. And then after that is to the area palpation for the thorax expansion. So placing your hand on the lower chest and asking the client to take a breath. So sir, can you take a breath po? Again po. Okay po sir, thank you. And then after that is to place the palmar surface of your hand along each costal margin with the thumbs close to the mid-stir line, and then pinch up some skin between your thumbs and ask the client to take a deep breath. So sir, I will pinch some of your skin here, and let me know po if you feel pain, ganun po. And po, sir. Okay po, sir. Thank you po. And then, after that is to um, the movement of the chest beneath your hand should feel smooth and even. And your tongue should move apart and the skin move smooth and the chest expand with inspiration. Thank you po, sir. And then after that is to palpate for the factile firmitus. So, feel your vibration on the chest wall while the client speak. So, sir, can you speak po, sir, while I'm feel the vibration? Thank you po, sir. And then after that is the explain that you will be placing your hand on the various areas of the chest while the client repeats 99 or 1, 2, or 3 in a clear, loud voice. So, sir, can you tell me the word 99? Can you tell me the word 99 po, sir? Okay po, sir. Again. Okay po, sir. Normal naman po yung voice po ninyo. And then after that is to use the ulnar surface of the hand or the palmar surface of the hand at the base of the metacarpophalangeal joints with when the palpating the firmitus. Ayan po, sir. Okay naman po, sir. And then after that is palpate and compare symmetrically areas of the lungs movement, moving from the side to side and apices to the bases. So, sir, can you breath po? Okay naman po yung moving niya, sir. And then after that is to firmitus normally diminish as you move from the large small airways and it decrease or the absence or over the pericardium. And then after that, for the percussion of the anterior thorax, penetrate the approximately 5 to 7 centimeter to assess underlying structure. The usual sound is resonance. And then begin at the apex of the lungs, and then ask the client to turn the head of the opposite side of the percussion to increase the size of the surface required for placing your finger to avoid interference for the clavicle. So, wala naman po akong narinig na any kinds of abnormalities, sir. And then after that is to move the chest wall and place the finger into the intercostal space parallel to the ribs during the percussion, and then percuss the anterior chest for the side to side and comparing to the sound, and then in the intercost spaces for the percuss the bases and laterally mid-axillary. Okay naman po siya, sir. Symmetrical po yung sounds niya. And then after that is avoid percussion over the clavicles, sternum, and the ribs. And then after that is to percussion over the heart will produce dullness of the left of the sternum from the third to the fifth intercostal spaces. And then percuss the left lung lateral to the mediavicular line. And then after that is to percussion sounds in the lower left thorax change for the resonance by tympani or the gastric air bubble. Percussion sound in the right lower thorax change from the resonance to the dullness of the upper liver border. And then after that is to auscultate of the anterior thorax. So I will use this stethoscope. So ask the client to breathe deeply and the mouth each time to the stethoscope and place on the chest to let you know if the client is becoming short of breath. So can And then after that is place the stethoscope over the trachea above the sternal notch and then excuse me, to hear the bronchial breath sound. And then after that is place the stethoscope in the apices, the triangular areas just the superior to each clavicle to hear the vesicular sounds. Vesicular sounds. And then after that is to auscultate the bronchial at the second and third intercostal spaces of the left and right external borders to hear the bronchovesicular sounds. And then after that is to move the stethoscope from the side to side as you compare the sound and then move down to 6 intercostal space and laterally to the midacillary line to hear the vesicular sounds. Okay naman po siya, sir. Symmetrical naman po yung sound niya. And then, after that is to assessment of the voice sounds. So, the client, same position, and then ask for the percussion and auscultation, and then explain that you will be listening to the chest while the client say the words or letters or the numbers. So, sir, I will let me hear your voice using my stethoscope. Using this word, can you say Brune? Okay naman po siya, sir. Wala naman po akong nakikitang any kinds of sounds na magiging problem po sa inyo. And then after that is to auscultate of the voice sound. Use the same pattern for evaluating the sound as for the auscultation of the lungs. And then bronchophony, ask the client to say 99 each time, and you place stethoscope of the chest. Sir, can you say the word, the number 99? Again, sir. Again. Okay, sir. Thank you po. And then after that is to, for the egophony, ask the client to say E, and each time place the stethoscope to the chest, and then you will know if it is normal or not. Sir, can you say the word, the letter E? Again, sir. Okay po, sir. Thank you po. Percussion of the posterior thorax. So, visualize and landmarks, and then observe for the thorax and visuals, and for the horizontal and the vertical lines, and the level of the diaphragm, and the fissures for the lungs. Observe lang po natin, sir. Yun naman po siya, sir. And then after that is the explain to the client that will be tapping on the chest in the variety of areas. And then percussions allow the assessment underlying to the structures. And then the unusual sound in the thorax is resonance, low pitch and hollow in the sound. And then tell the patient to breathe normally through this examination. So, sir, in this examination, I will tap po yung variety areas ng likod po ninyo. Is it okay for you po? Okay po, sir. So, habang ginagawa ko po ito, can you breathe normally po? Thank you po, sir. Okay naman po, sir. And then, after that is to ask the client to forward and the shoulder. So, sir, can you forward po? Okay po, sir. Thank you po. And then after that, this position will be scapulae laterally, and then permitting more area, the upper vertebral borders, and the widens intercostal spaces for the percussion. And the position the client so that your arm almost fully extends throughout the percussion. Okay po, sir. And then after that is to percuss the lungs. So place the finger into the intercostal space of the patient, and then parallel to the ribs during the percussion, standing slightly to the patient, and the finger lie more firmly on the chest as you move through all thoracic area. So, sir, I will palpate your lungs. I will percuss your lungs rather. Thank you. Ask the patient to exhale and inhale and determine the level of the diaphragm during the respiration by placing the finger above the expected level of the diaphragm. Sir, can you breathe po, exhale and inhale? Thank you po, sir. And then after that is to percuss in the step downward until the dullness replaces the resonance. And then on both sides of the chest, mark those areas. This mark should be at approximately level of T10, and then the mark should be parallel. So let's assume that this is a ruler and this is scale marker. And then after that is to measure the diaphragmatic movement by asking the client to fully exhale and starting at the previous skin marking of the left chest and then percuss upward from the dullness to resonance and mark the area. So sir, can you fully exhale po? Okay po sir. And then after that is to ask the client to inhale fully and hold it as you begin to percuss from the level of the diaphragm and then downward and moving from the resonance to the dullness and mark the area and repeat the procedure in the right chest and then use the ruler to measure the differences between the marks for exhalation and the inhalation. And then after that is anticipate a greater distance of physical fit in the client. So for the auscultation of the posterior thorax, ask the client to breathe deeply and then the mouth each time stethoscope is placed on a new spot and tell the client that to let you know if he or she becoming tired for the short breathing. So, sir, can you breathe po? Open your mouth too, sir. And then take a breath. Tell me, sir, if you have a trouble for the shortness breath. Okay po, sir. And then after that is visualize landmarks as you did before and percussing the posterior thorax and then compare the result and should be symmetrical such as speech instantly and then intensity, quality, and the duration. And then after that is the auscultate for the tracheal sound of the vertebral line for the superior to C7. And then after that is to auscultate for the brachial sounds and to start a vertebral line at C7 and move the stethoscope down towards the C13, and then the sounds will be bronchial. And then after that is to auscultate for the bronchiovascular sounds for the excuse me, for the right and left primary bronchial, and located at the level of the T3 and T5, and auscultate the right and left of the vertebrae at those levels, and breath sounds will be bronchovesicular. And then after that is to auscultate for the vesicular sounds. So, auscultate the lungs by following pattern used for the percussion, and then move the stethoscope from the side to side while comparing the sounds. So, okay naman po yung sound, sir. Wala po kayong dapat ikabahala. And then after that is the breath sounds over the the posterior surface are the vesicular. So, for the interpretation and documentation of the findings, refers to the descriptions and interpretation of a normal and adventurous breath sounds. So, for the data for documentation, so date and time, and the procedure taken, and then the procedures and the findings done, and then the if with abnormal findings and action that taken to your patient, or referral for the physician and to the intervention done, and then patient's response to the intervention. So, before anything else is, don't forget to perform a hand wash, hand sanitizing, and record the patient findings. So, sir, harap na po kayo, sir. Thank you so much po, sir. So, okay naman po yung record po sa inyo.